Hello friends, we are going to study some MCQ question of the anatomies. First one question, the largest synovial joint of the body is? The answer is knee joint, and it is also the most complex joint of the body. Knee joint is the largest synovial joint present in the body, and it is the most complex joint present in the body. The second one question is, ansa cervicalis supplies which muscle? Ansa cervicalis supplied which muscles? The answer is ansa cervicalis is a nerve in the neck formed by the fiber derived from first three cervical nerves. It lies embedded in the interior wall of the carotid sheath at the level of lower part of the larynx, and it supplies muscles superior belly of omohyoid muscle, inferior belly of omohyoid muscle, sternothyroid muscles, and sternohyoid muscle. It supplies these four muscles. Then, what are the structures present posterior to the right and left kidney? Muscles that are present posterior to the right and left kidneys are diaphragm, medial and lateral arcuate ligament. Third number is psoas major muscle. Fourth number is quadratus lumborum muscle. Fifth number is transverse abdominis muscle. Sixth number is subcostal vessels. Seventh number is subcostal iliohypogastric and ilioinguinal nerves. And the eighth number is 11th and 12th ribs. The fourth number question is, single umbilical artery indicate abnormality of which of the flowing system? The single umbilical artery indicates the abnormality of the renal system, because unilateral means one-sided. Unilateral renal agenesis should be suspected in newborn with single umbilical artery. If a newborn has a single umbilical artery, and it is suspected that there is a unilateral renal agenesis, or one of the kidney has not developed. The fifth number question is, right suprarenal vein drain into? The answer is inferior vena cava. Now we are discussing about the venous drainage of adrenal gland or venous drainage of suprarenal glands. The venous drainage of suprarenal glands or adrenal glands are: the right suprarenal vein drain into the inferior vena cava. The right suprarenal vein drain into the inferior vena cava, and the left suprarenal vein drains into the left renal vein. Okay. And sixth number question. Winging of scapula occurs due to weakness of which muscle? Winging of scapula occurs due to the weakness of which muscle? The answer is serratus anterior muscle. The origin of serratus anterior muscle is upper 8 ribs and its fascia. Insertion is middle border of the scapula on its costal surface. The action of the serratus anterior muscle is its help in pushing and punching, and nerve supply is C3, C5, C6 and cervical 7. Now we are discussing about the muscle of hand supplied by medial nerve. What are the muscle of hands, or what are the name of the muscles present in hands which are supplied by the medial nerve? The first number is abductor pollicis brevis. The second number is flexor pollicis brevis. Flexor pollicis brevis is also supplied by the deep ulnar nerve. Then the third number is opponens pollicis. Fourth number muscle is first lumbrical muscle. The fifth number is second lumbrical muscle. There is one point. There are 20 muscles in hand, of which all are supplied by ulnar nerve except the 5 muscles which are supplied by medial nerve. The 5 muscles I mentioned before: abductor pollicis, flexor pollicis, opponens pollicis, first lumbrical and second lumbricals. These are the 5 muscles supplied by the medial nerve. Other than that, all muscles are the hand are supplied by ulnar nerve. Eighth number question. Labyrinthine artery is a branch of which artery? Labyrinthine artery is a branch of which artery? The answer is basilar artery. Branch of basilar artery are pontine artery, labyrinthine artery, anterior inferior cerebellar artery, superior cerebellar artery, and posterior cerebellar artery. The branch of basilar artery are pontine artery, labyrinthine artery, anterior inferior cerebellar artery, superior cerebellar artery, and posterior cerebellar artery. The structure of the passages of foramen magnum are anterior part of the foramen magnum are membrane, tectoria, apical ligament of dens. These two are the structure that passes at the interior part of the foramen magnum, that are membrane, tectoria, and apical ligament of dens. And the posterior part of the foramen magnum, the structure that passes are lower part of medulla, meninges, and cerebellar tonsils. The structure that passes through the foramen magnum at the subarachnoid space. From the subarachnoid space of the foramen magnum, the structure that passes are vertebral artery, anterior spinal artery, posterior spinal arteries, sympathetic plexus, and spinal accessory nerves. These five are the structures that passes through the subarachnoid spaces of the foramen magnum, that are vertebral artery, anterior spinal artery, posterior spinal artery, sympathetic plexus, and spinal accessory nerve. The ninth number question: Pierce patches are present in. The answer is Pierce patches are present in ileum. It is present in ileum. It is circular in shape, 1 cm wide, 2 to 3 cm long. Pierce patches are present in ileum. 10th number question: Where is the appendix epiploica is seen? It is seen in colon. Then the 11th number question is: the inferior mesenteric vein opens into. The answer is splenic vein. The 12th number question is: the deep inguinal ring is a defect in. The answer is fossa transversalis. Deep inguinal ring is a defect in fossa transversalis. Here comes the deep inguinal ring. It is an oval opening. It lies half inches or 1 centimeter above or superior to the mid-inguinal point, lateral to inferior epigastric artery. 14th number question: aorta passes through diaphragm at the level of which vertebra? The answer is thoracic 12 vertebra, with the lower border of T12 vertebra. And 15th number question: middle cerebellar peduncle is formed by. Middle cerebellar peduncle is formed by dash dash tract. The answer is pontocerebellar fiber. And middle cerebellar peduncle is formed by pontocerebellar fiber tract. And 16th number question is: nerve supply of popliteus muscle. What is the nerve supply of the popliteus muscle? The answer is tibial nerve. Thank you very much.